Hey everybody, my name is Ruida Hou. I'm a postdoc researcher in the Center for Pharmacogenomics at St. Jude Children's Research Hospital. I'm a 2026 awardee of the PhRMA Foundation Postdoctoral Fellowship in Translational Medicine. The story that started my journey in science is from medical school. I was trained as a physician, but during my rotation in clinical settings, I gradually realized not every patient will react to their treatment as they were written in textbooks. They'll start asking, why is that? And that leads me to my PhD study in the University of Tennessee Health Center in pharmaceutical science and later in pharmacogenomics. Pharmacogenomics help us to understand why different people will react to the same treatment differently. That's because something in their gene. My research primarily focused on acute lymphoblastic leukemia, which is the most common type of pediatric cancer. So first, we want to study why those leukemia cells, they proliferate, they grow so fast, because they tend to make more of their DNA or RNA, which are essential for their growth and proliferation. And then we found there's a specific enzyme called the dehydrogenase. It's an enzyme that helps the cells so that they can proliferate and grow. And our study basically focused on a group of drugs targeting this enzyme by using CRISPR, a genetic tool that could study thousands of genes or even 20,000 genes at the same time. Using that tool, we were able to identify different molecular targets. Some of the molecular targets will induce the treatment resistance, which makes the patient kind of not respond to treatment. And some of the molecular targets will make the patient more sensitive to treatment, that indicating probably more toxicity when they're receiving the same dose of the chemotherapy drugs. We found an answer like how we can use this drug, to what patient we're going to use this drug. And also it helped us to answer once the patient develops resistance, how we can help them to tailor the treatment. This is really important to my life also, how I met my wife. So back in 2014, we were both interns at PhRMA University. And I met this girl on the department seminar. And I know it is the person. During science, you may find research, you may find your data is going to be impactful, but also you may find something going to really could influence your whole life. We're exploring something unknown every day. We're trying to figure out, because what we will see is in most common case where we see just the tip of an iceberg, but we're trying to explore more. And sometimes your result didn't come as you expected, or you find something that's completely contradict what has been written on a textbook. But that's also something I want to tell the young researchers: don't be afraid that you're just finding maybe the truth, right? This is really one really cool part about science. Yeah, we love to travel. We love to embrace the great of the nature and everything, and also help us to spur ideas when we come back to our lab. Once we see something in the nature, we think, okay, well, this could be a kind of solution for my recent research. And then we come back and try something more, try something fancy, and that may help us to solve problem. One advice I'd like to give a younger self is don't be afraid of failure. So when I first stepped into science, I could not even do cell culture. I could not even do PCR, but just keep trying. And whenever you have the data that is not as you expected, just first try to troubleshoot it and then just keep going, because your hard work will always give you something back in return, and just keep trying. My future career goal is to become an independent researcher, to start my own lab so that I could keep my research project on pharmacogenomics. I think that will help more patients and help translate our bench research data findings to clinical use.